Chlamydia has to be a venereal disease. Such a pleasant sounding word.
Chlamydia?
Chlamydia.
Chlamydia. I think I might name my daughter Chlamydia.
Hello, my name is Samantha Garcia. Welcome to my project on STIs, sexually transmitted infections. Today we will be discussing chlamydia. We will go through symptoms, treatment, and what happens when it's left untreated. Now that we broke the ice with a funny video clip, let's begin. Chlamydia is an STI caused by the bacterium Chlamydia Trachomatis. It can affect both men and women. It is transmitted through sexual intercourse with an infected partner. This can be vaginal, anal, or oral sex. There are many symptoms to look out for. Here we have a few symptoms for chlamydia. For men, painful urination with a burning sensation, swelling in the testicles, redness, itching, or swelling at the opening of the urethra, and discharge from the penis. For women, painful urination with a burning sensation, lower abdominal pain, painful sexual intercourse, bleeding between periods, bleeding after sex, and vaginal discharge. If anyone experiences any of these symptoms, it would be best to find treatment. Chlamydia is curable. Chlamydia can be cured by taking medication prescribed by a doctor. This is usually in the form of an antibiotic. It is recommended to abstain from any sexual intercourse during treatment and up to 7 days after. It is also recommended to let your sexual partner know about a recent diagnosis so they can be diagnosed and treated as well. If your partner is unaware of the infection, it is possible to become infected again. If it is left untreated, it can lead to serious health complications, especially among women. Here we have a list of serious health complications that can happen when chlamydia is left untreated. For men, prostatitis, the inflammation of the prostate gland, scarring of the urethra, infertility, and epididymitis, an infection of a tube in the testicle. For women, pelvic inflammatory disease. The progression of PID can permanently damage reproductive organs as the infection progresses in the uterus and the fallopian tubes. Ectopic pregnancy. As a result of PID, a fetus can be developed in places outside of the womb, which can be life-threatening. And infertility. Preventing sexually transmitted infections. It is common to have a repeat infection with chlamydia. Whether you've never had an STI before, or you are avoiding a repeat, here are a few ways to prevent it. Abstinence. The most reliable way to avoid infection is to not have sex. This includes vaginal, anal, or oral sex. Condoms. A male latex condom, when used correctly, can decrease the risk of an STI transmission between partners. Reducing the number of sex partners. This can also decrease the risk of STIs. Mutual monogamy. When two people agree to only be sexually active with each other. And avoiding sex while under the influence of drugs and alcohol. This can reduce a person's ability to make good decisions while under the influence. Chlamydia trachomatis. What we learned. Chlamydia is a common STI among men and women. It is a bacterial infection that can be cured in a single dose of antibiotics if diagnosed early. receive an STI screening before sexual intercourse with a new partner, have multiple partners, or experiencing any symptoms. And always practice safe sex. Thank you for watching.